And you're what?
All right, good morning. It is, April 15th. That means, hello. All right, Senate Finance
That
now,
was in your file.
right? Tax day, and this is Senate Health and Welfare. We are looking at the budget requests that have come to us, and Nolan's done a great deal of work, as has Kiki, in putting this information together for us. So Nolan, why don't you share with us what we have?
Sure. For the record, Nolan Langwell, the Joint Fiscal Office. There are two sheets. The first one has pink on the top, and that are requests that are not, those are new requests that aren't already in the budget passed by the House. The orange one, second sheet, it's like a 1-pager, 1.5 pager. That is stuff, requests that were already in the budget. When people wanted to show support for them or whatever. This sheet, some disclaimers. There are a lot of typos, probably. I tried not to have too much duplication. Amy already flagged one duplicate. And they're in no particular order of priority, or just because something comes before something. It's not based on any bias. It's just what the order for which I entered it in. To the best of my knowledge, I tried to put what section of the budget it was, what agency or department would fall under. I'm sure there are errors. I'm sure that people are going to say, I meant this or that. And this is why I say it's draft work in progress. But I did the best I could to try to capture all the requests, giving enough information for you to kind of glean what the request is, but without doing the whole dialogue, because we don't have so much space. So that's what these sheets are.
Can I ask a question?
Yeah, go ahead. Now, if I make a comment, go ahead.
Great. Thank you for the clarity. That's very helpful. Process question for you, Madam Chair. Are we spending most of our time or all of our time today sort of prioritizing which items we support that are already in the House passed budget, or are we going to be focused on what's not in the budget?
So I think our priorities are what we see as important going forward relative to our work in this committee. So whether it's in the budget or not. So for me, as I looked at this and went over it different times over the weekend and then last night, we've put a lot of effort in here in some of our bills. So for example, S-126. So I say, well, our bills probably are priorities for us because we pass them out of here, and they do have budget requests that may or may not remain whole when they go down to the Appropriations Committee. The other piece of it for me, and this is my perspective on this, is that we have a gap year for primary care coming up. We're in between our current all-payer model and ahead. And that, for me, becomes important that we maintain our primary care services. So primary care overall becomes another place that we should look, and what can we afford here. Secondly, we'll know that our demographic is changing, and we've had significant pressures on long-term care facilities. So I look at both ends of that developmental spectrum and say, these are things we have to look at. Then I look at the special fund that we currently have for childcare, and that special fund in and of itself takes care of what we're seeing for childcare. Then we have other really important areas. Nothing on these sheets is unimportant. And it's critical that we maintain some survivability, I guess, sustainability for other programs. And we know that there are some places where the needs are very great. So how do we balance off the requests for our substance use disorder folks? And how do we balance off our requests for mental health? And then other areas of support for kids, whether it's Children's Integrated Services or others. And then how do we look at the long list of requests for food and food banks. So we have a lot here to consider. I started to cluster things in my mind as I have just said. And, then we also know we have H91 that we're working on. So in some ways, I'm thinking that that bill is going to pass out of here, and there are some things associated with H91 related to the caps, like the $6.25 million it's in there. That for me is part of H91, and as is the EA program, part of that H91, more or less, and there's a $30 million currently in the budget. So holding that aside, I think, because when we vote it out, we'll vote it out, that will become one of our priorities, and I think appropriations will understand that. We've had some requests here. If you look at, for example, we've had the Maple Mountain residency program request. We also have a request by the Gifford Health Center. Those two things are very similar. It looks to me, I know they're different, but they're same. I get that. I don't need that. Please, okay? So we have those requests, and those are things that are done sequentially. Then we also have requests from Recovery Partners of Vermont. We don't have a bill on that. But some of the stuff that we get is in H218. That's related to opioid settlement fund. Okay, so we can deal with those things from the settlement fund when we get to H218. So some of these things don't show up anywhere. And then, so I will just tell you that when this gets down to the Appropriations Committee, there's already an overage. You know what I mean by that? There are more requests than there is money. And then we're going to be told down there as a committee down there, relying on some of the things we do here and ask for in the future. We're going to have to cut $80 million out of the budget. So I'm just telling you, this is not an easy process. We do need to make decisions that some people aren't going to like. And that's the way life is right now. And if you layer on that the cloud of authoritarianism that we see in Washington, it's even worse. So we need to be very careful about trying to keep ourselves moving forward on the pathway that we have already set with some of our bills, and then the bills that are coming. I can't say any more than that. I don't have anything more to say.
I mean, this is based on current revenues and current federal mandates. We don't know what mandates are coming, like what money's going away. We're just finding out what money has gone away. I went to a meeting that Senator Welch held with local businesses yesterday. What I heard from local businesses makes me pretty sure that our revenues are not going to hold next year. If they can get product to sell is iffy. It may cost significantly more. Reservations, anything that depends on Canadian trade, and they are one of our largest sources of, hospitality revenue, is way down. One image said they usually were like 24% of their website hits. They're down to less than 1%, and they've had a number of people that come every year are not coming. And they've been very specific in several cases about why they aren't coming. So the revenue picture, which makes me really hesitant to do any expanding of new programs, because I think we are going to face some really painful cuts in trying to maintain a safety net over the next few years. And if anyone hasn't been through that process, Jenny, you have, I have. It's very painful. And I think we're headed there again.
So, right. And so the one comment that you made, I think that bears repeating, beside what we're gonna be looking at revenue for next year. Right now, a holding pattern, keeping things whole, improving what we can. Looking back at programs that have had increases recently, we want to understand that, no one's gonna help us with that. And then the other one that you mentioned is new programs, so. Starting new programs now, if it solves the problem if it solves a big problem, good. See what happens. Okay, Senator Gulick.
I want to take an opportunity to put a finer point on what my colleague Senator Cummings said. And just point out the fact that, yes, our state is going to suffer. And it's because of the President of the United States and the toxic, evil administration that he has in place right now. We are all going to suffer. And the more we say it and the more we shout it, maybe the quicker we'll have some change. But to me, this is unacceptable and it's criminal. Number one. Number two, my understanding is that we're buying down the tax rate to the tune of tens of millions of dollars, taking money from the general fund and from the education fund. There are many tax bills, property tax bills across the state that will be going down, and I am at a loss as to why we find it necessary to take that action right now. I am not in favor. I wish we could use some of that money to support these programs.
Well, this is an important message that we can send down to the Appropriations Committee. Which is why we prioritize. And then we set our priorities. And then we can make a blanket statement about buying down to zero on property tax rate may not be as important as supporting some of these other needs that we have in the state. So that is something that we can put together. Not there, so we're good. Okay, so Nolan.
On that happy note.
No, but I'm with you. I mean, the authoritarian, that's what I said. It's an authoritarian one.
Yeah, you're absolutely right.
The report we got this morning is very disturbing.
Yeah, it's very disturbing. It could be anybody, just because we say something in here, right? For terrorists. Exactly.
Come get me.
So I'll start I'm not gonna run through every line of every sheet, but I thought I would at least kind of do a quick run through of this is the one that's orange and this is the stuff, the policies that are in the House budget currently. So those things are in play. So we've kind of gone through them a little bit with you guys prior. I'm just gonna run down the sheet that's on here that people asked for to support or asking the Senate to support. So I'm just going to kind of run through them briefly.
So which one are we on? Orange.
We're on orange.
We're on orange.
The other thing I added on the sheet too, just so you guys, I have it on both sheets, is at the bottom. Is I also have the bills that are either passed out of this committee or are in your committee, so you get a sense of the money that's also in play from bills. That's on both sheets. So, again, so we have the first one you'll see, and I'm going to do quickly. We have the SASH and blueprint. This is the ACO transition. This is in the GovRec as well. It's 4.5 in one time, and it grosses up to $10.8 million in global commitments. We have the comprehensive payment reform. This is to replace loss of OneCare, Vermont fixed monthly payments, to independent primary care physicians. This was in the House budget as well. It's $804,000. We have the statutory nursing home rate increase that's in the GovRec and the House budget, 6.3 million, and it's 15.4 million global commitment. We have 2.8 million. This is the rate study for home and community-based services. This is the choices for care specific. So it's not going all home and community-based. It's for the specific categories of choices for care that are that the House felt were significantly underpaid. This would bring them up to 2023 levels. It's 2.8 million in general fund. It comes out to almost $6.8 million in global commitment. There's also a 2% home and community-based rate increase. This is a separate group of home and community-based service. That this would be 2%. Senator Lyons and I were talking prior, this group has received rate increase, very, very, very modest rate increases over the last couple of years. I don't remember what they were, it was between 2 and 3%. Even though inflation is higher than that. So, House decided 2%, which comes up to 2.8 million. I will say, sorry, 5 million, my apologies. And that grows up to 12 million. I will say there's a very small group, I believe, of folks that fall into both categories, the rate study and the home community. There's no way to parse them out, and it's a very, very small amount. And it's so I'm pretty sure there's a very small overlap there. But there's not a lot. But we have empty arms, $40,000 one time. It's in the House. We heard this is the FQHC rate increase. It's $4.4 million. It grows up to 10.7 global commitment. Mary Kate flagged me in the hall and reminded me that there's some confusion. The rate increases are for FQHCs, but DEVA has said that the way that they pay FQHCs and rural health clinics, RHCs, they can't do rate increases for one, not the other. And so we haven't gotten clarity about whether this would go to both or just FQHCs. So there is a sort of question mark on this one still. And we don't have answers for
Is that,
clarification.
that's line 7 then?
Line 7, yeah.
Yeah, okay.
So, the House intended it to be for, I believe, specifically for FQHCs, although they were specific. So anyway, my point is there's some clarification about whether that would go to both or just FQHCs. So put a pin in that one. This was $85,000 for family planning, E&M, it's evaluation and management codes. These are specific codes around family planning. It's a 90-10 match, so $885,000 would gross up to $850,000 total. Easter Seals, they just wanted to, if I recall, they came in just to say thank you. They had 1.25 million in the budget, already in the budget, and I remember he came in just to say thank you for doing that. Howard Center. They're asking for $160,000 for community center outreach. The governor actually had cut the $160,000 and the House put it back. Line 11 is Howard Center embedded clinicians and pediatric offices. First call, same thing. The governor had cut $269,411. The House put in $160,000 back. Sorry, they put $249,000 back. So there's a $20,000 reduction gross, and so I believe they're asking for the full. We have Vermont 211. They're asking for $140,000. It's in the House budget. It grosses up to $332,000 global commitment. And so total asks, it's about $26 million of things that people had highlighted to support that are already in the budget. I will do this really quick. The next page is on both documents. I just want to run through really quick what bills you have. So you have S-126, S-27, S-53. Oh, sorry. Yes, these all passed. Is it H-53? Sorry, there's a typo, right? Yeah. Right, dual started here, right?
Yeah.
Okay, so that's a typo. Okay, so those are 3 bills that you guys have passed. It was $2.9 million in general fund. For 126, it's $1 million for S-27, the medical debt relief. This is $1 million coming from the treasurer's office towards this. And then dual is required a one-time $25,000 appropriation to OPR. Now the Senate, as you know or may not know, as you all know, I know Senator Lyons knows, is that they strip the appropriations out of the individual bills, so that they can look at the whole appropriation within context. So these are in play, but those bills have left. On your wall, you have H-91, which is the BHARF. This is the GA Emergency Temporary Housing Bill that came out from the House. That has $10 million in one-time general fund. And then you have the H-218, which we're going to do in about an hour. There's about $9.8 million in, from the opioid abatement fund. And so this bill is only appropriation from the opioid abatement fund. You'll hear more about it, but it's based on recommendations from the opioid abatement special. So those are the total, and there's $23.8 million in total appropriations between those bills. Just this,
Good. So the one thing that, the question, a lot of the proposals for, rate increase or backfill, have global commitment match. So that does make it that it's not all coming out of the fund.
next sheet.
But then, and then also you and I had talked about the, rateable increase, the rate, nursing home increase, and then the, home and community-based service rate increase. Regardless, it's still, there's still it's still a match for.
Yeah. So on this pink one, this is not, this is new asks, not in the budget. There were $83 million in asks. Although subtract 6, and Amy Schollenberger flagged one duplicate, which is number 47, is the same as what's asked in the line 23 and 24.
Yeah.
So I'm gonna go with 23 and 24
Okay.
and delete 47 when I fix it. But I want to just flag it. I'm not going to go through every single one, but I want to flag a couple because there is some overlap. So I'll start with line 2. As I just mentioned, there's 2% rate increase in the budget. It's 5.1 million. The DAs and SSAs were asking for a 6.2% increase of 13.95. So I just want to flag that they're asking for 13. There's 5.1 in the budget. The other one I want to flag is line 7. There's a request for 1.5 million. This is from opioid funds. I think that you guys will take this up in context of H218. So I want to just flag that you see there. I want to flag line 26. We had a clarification from the Vermont Legal Aid that the Medicare Savings Program wouldn't need 416, it would actually only need 155,000.
Yay. At $300,000.
Yeah. The other one on flag is line 28, 29. This is the CCFAP, where there was an ask, so that, as you may recall, the governor's recommended budget diverted $19 million to back to the general fund because it was not needed because of the timing of revenues. Anyway, long story short, we did this in BAA, we did it again in the budget. The House spent 4.5 of that to go towards rates. And then I know Let's Kirk Fitz wants the whole 19, but I think there's some stuff happening and negotiations happening about an approach forward. I'm not in the loop on it, but just want to flag that I think that there are conversations happening around how to deal with that. And then the last one I want to flag, not the last one, but line 37, you have Cathedral Square, the Housing Conservation Board. They're asking for 13.5 million, but there's 5 million in the GovRec and in the House budget. They're asking for additional 8.5 million. Line 38, I just want to flag, it says 2.4. There's actually 2 requests in there. They want 400,000 for SASH for all pilot operating in Brattleboro, and another 2 million to go statewide. So it's 2 million plus 400,000. So you don't, you could just wanted to divide that up just to flag that. And then 48 NOFA, They're asking for 500 for cash, prop cash, and 300,000 budget. So that's just a real high level of just where there is some overlap, or there might be some money in the budget. I just want to more situate you to get a sense of how to read the sheet. And there's also some requests for language. Where there was requests for language, I included a link. So if you go online, you click on the link, you can see what language that they were requesting to have. That's all I have to, unless people have specific questions. I was really just trying to orient you with the sheet. I'd sent a version to you guys over the weekend. That was my very, very, very crude. And that was everything all in one. I took the time yesterday to kind of break it out, try to make it a little cleaner and easier to read. And also what I tried to do is some organizations had the same request. So for instance, the 4.6 million of line one, we had that request from my state and we had it from my medical society. So I combined them. So it might not be the verbiage that they use, but I tried to consolidate, if more than one had a similar request, to try to lump them together into one. So you can see that. And then, the last thing we'll talk about is line 4. We have to go back to the 2% increase for home and community-based services. We've been hearing that from the advocates that adult day and skilled home health were not included. When I talk to AHS, they tell me they are. I haven't gotten clarity on that. But according to the coalition, it would need another 75,000 for the skilled home, and then the adult day. I don't have a number for that. There needs to come. At least I don't have one at the moment. But I want to flag that the advocates are saying that those specific groups are not included. But when I asked AHS about it, they say they are. And my hands are tied. I can't.
Not your job.
Yeah, I can't clarify. I believe both sides.
Got it.
Well, if they are, then there's probably not enough money to cover all the costs. If everyone got.
Yeah, it's just, I think it has to go. And, Jill's tried to explain it to me, a few times. It's complicated, and, I don't have any recourse to go to AHS and say, you're wrong. So I just want to flag it.
So we have here, I'm just looking, so the first line on in the pink sheet is the combined amount of money that we would need to maintain sort of primary care FQHC through 26. For me, that's a real priority. And then going to the second line, the 6.2% Medicaid rate increase for DAs and SSAs. And I'm probably going to hear about this in the hallway. When was the last time we gave a rate increase to the DAs and the SSAs? And how does that relate to other sets of organizations who may or may not have had increases? And I'll look at the long-term care.
I was asked to raise money last year for 3% increase for DAs.
Well, it was across all home and community-based services,
Right.
not just the DA. So the group that is part of the rate study and the group that's part of the 2%, they all got the same increase last year. I couldn't remember. I think it was 2 or 3%, and then the prior before
Right.
that, there was another increase of 2 or 3%.
8% was the year before.
Was that
It was 8%.
8%? So there has been some increases.
That's good.
This is the first time that we kind of broke the group out and tried to give one group, because there's one group that seems to be the house dog. There's one group that was way farther behind. So that's why it's separated versus in the past. There's just been rate increases for all the home and community-based providers, which included DAs and SSAs.
It's eventually level funded then when it comes down to the last $1 million.
And again, this 2% isn't just DAs and SSAs, it's other home and community-based as well.
Right. Okay. And some of it's not huge. Okay,
So the House, working within their context, felt that 2% fit within their context.
well, it's all to get up to 2023.
Well, that was the different, that's the other group.
That's the other one. Okay,
Those are specific to choices for care. I believe.
Then-
NPRC,
the recovery centers, so we've got here H218.
what line are you on?
I'm looking at line 8, 5, actually at lines 5 through 8. Okay, so line 8 is in H218, so that would be coming from the special fund. Then the recovery partners request is also coming out of special fund. So I'm gonna I'm looking for help here because I know that the agency has asked for. There was $1.5 million in the budget for, in the governor's recommend. Where is that for recovery? Recovery
Right, so let the recoveries.
center,
Yeah.
campus, where is
I was
that?
like,
It's not funded.
so the House didn't fund it.
What, so, but and it's nowhere in the budget right now.
It's nowhere in the budget and nobody came in to request. it.
Okay, and the agency drafted me an outline of language. My thinking on that one is, let's see a bill. Let's see a bill on that. Let's see something during, maybe in January. You can't just put something in for which there's no
And the House felt they didn't have enough information to.
information. That's, yeah. And we did. I asked for information. I got it. It looks really very interesting, but I think it's something we would have to go through in this committee before we could, pass it out as a bill or make a recommendation.
Who's my sharing the.
I had somewhere down in appropriations. Yeah. It's just bullets. Oh my. Okay. It's not a bad idea. Somebody said things are bad ideas. It's that. How well fleshed out are they?
And the chair's point for line 7 and 8. We'll be talking about the opioid special fund in a little while, so you
Okay,
can see what's.
right, and 218. So I'm looking at line 6 and 5. 5 and 6. Additional days for local recovery centers. We don't have a bill on that. And ongoing operations.
So my understanding on this one is this is different. I'm being told that 300K for the residents is in the House budget. Okay. Line 6.
Is in the budget?
That's what I just got to know. Thank you.
It's in the budget?
That's what the note says. So there's multiple pieces, right? So
Oh, yeah,
we don't
I
just
see
see,
it. B313
how much? Okay.
says it's there.
I don't know if it's in my sheet though.
No,
Yeah, so that's just an
I
error.
think the House
But there was a piece too where,
reduced.
what's in the opioids bill, I believe is like, has to do with certain things around. It. So this is, I believe, base, like ongoing operations, where the other asks, there's other stuff. Okay,
Right.
so we just see recovery residences, there's different purposes for each of those buckets.
Where we haven't had the report back on looking at a comprehensive system of recovery in the state, which was going to come back to us this next fall from S186. So this is almost premature to that report that we're getting back to have that comprehensive report. Both this request and the request on the part of the agency to put in the recovery campus expand. So it's not that we're not for it. Doesn't have the broader context. Hate this. All right. Questions of Nolan committee, any other line items you want to look at? I don't think about. Can we go to, let's go to food. Let's go to Bright Futures and Food on page lines 16 through 20. So 16 is building bright futures. That's really a specific question to cover operational costs and meet statutory requirements. Base funding. Yeah. And then we've got lines 17, 18, and 19 on the Vermont Food Bank. And that has been reduced by the House from to $1 million.
I wouldn't say it's reduced. I would say they got 500. They were requesting.
They got 500,000.
It wasn't reduced because it would reduce something that they got in the first place. They got something.
And this DPS, remind us what the Department of Public Safety request is for responsive readiness for food, because we had quite a discussion in appropriations about this.
I can't respond to that. I believe you look at the documents from Carrie Scholar,
Yeah.
probably has a little more detail about what that does.
They wanted to hold food in case of an emergency and have it available to send out. That was my.
Yeah, I'm sure she has something written that's clear on her. You go to Carrie Scholar, link from Friday. With all of these, you can go to links on Friday.
Yeah, my sentiment is generally that if things are as dire as they seem to be and becoming more so, we should prioritize keeping people alive who might otherwise not be able to make it. So whatever that might be.
The last thing I just want to say, actually, I should have said this earlier, is that the orange document, this is what the House's priorities were,
Right.
and your priority was different. This is your opportunity to decide what your priorities are.
Okay. Questions? Are there sections here that, so I'd like to kind of hear from you each, from your thinking about what your priorities are, because I've sort of given you my thoughts on priorities for primary care, long-term care, and then I agree with Senator Gulick. We want to put things in place that are going to hold people alive and preserve their wellness. We do have some programs that have been, for example, I know SASH has been trying to expand. Whether they expand across the entire state right now, that's another question. The keeping primary care embedded in Lund Home or our parent-child centers, I think those things we've been working on for a long time. Okay. So, and the Medicare Savings Program, which has now become less costly, 155,000 instead of 416.
Bridges to health is
Bridges to Health,
for multiple
that one in a time of crisis.
support.
I agree with you on that. And that one, I think we should, those two, lines 26 and 27, can we consider keeping those in? Oh, they're not anywhere right now.
And maybe for the cuts in Medicaid. What I've heard, they
Exactly.
able-bodied adults who get thrown off. Maybe 20 plus years ago, did Catamount Health to pick up because you had to have children in order to qualify for Medicaid or be disabled. Which that expanded Medicaid. And it sounds like that's what's going to be cut. And we may have to make the decision if families who make less than $44,000 a year for a health insurance policy are going to have access to health care.
Kind of not went away when the exchanges came along.
Yeah.
And the expansion.
Right. Its original purpose was to pick up lower income, single adult, childless adults.
Family of four, that is the 138%. Okay. Any other comments or identification of your interests?
I mean, I really agree with some of the comments, or statements. I'm not sure they're on board balls are talking. Right now we're see that we're kind of developing thing. And my priorities are things that work, things that have great bang for the buck and that support people that need to support. And you know, another kind of aligns with what I'm talking about is like 48, the cash crop program. I like that program because not only does it feed people healthy produce, but it also supports farmers. So it's double, you know, double bang for your buck, helps farmers and helps feed people. So those are my priorities.
That one. That's the
No,
only
not,
one
no,
you're
no,
mentioning.
I'm just saying that as an
Need
example
more than that, so.
of
Yeah.
what I like, which is
It helped if
efficiency.
we knew how long this crisis was going to last.
Yeah.
How deep a hole we're going to get dug into. If we just have to wait for the midterm elections to start
You
turning
need to get
things
through
around,
26.
then we got 4 years and we got 8 years, and we don't know what's going to happen to the economy in general.
Okay,
It's just a very uncertain time.
okay. Checking that one, that's a priority identified.
I also, you know, you go ahead.
Oh,
Yeah.
here's one that I think was in the budget adjustment that we all were supporting, and that is the Champlain Housing Trust, for, folks with disabilities. It's 46,
Or these,
line 46 on page.
Yeah,
Susan Arno.
getting the project over the finish.
Right, that project has been sitting there.
is this housing?
So then there's then we have things that really look critically important, which are the women's recovery housing in St. Albans and the other recovery housing. But that's a new program, okay? That's a new program.
I hate to start them up this year and then have to pull it next year. I mean, in some ways, that would do more harm than good.
Right, and they don't say base or not base. It looks like it's just a startup, but I don't know. And a lot of the recovery could be startup funds, for some of those things. But again,
Well, that's the question. Are they gonna be self-sustaining next year? Or are they gonna be self-sustaining depending on federal funding? Or are they gonna be self-sustaining?
then, moving over to number 41, on the previous page, so I'm going backwards. But Sam started it. Senator Douglas started the backwards motion. The Voices for Vermont's Children. So there's a lot of language there. We probably should look at some of that language, but it has the one request for $1 million in base was to continue the Reach Ahead pilot. We have to look at that report back on that.
Yeah, what,
We don't know. So who would like to look at that Reach Ahead pilot report? on behalf. That would be great. Do that and that will help us tomorrow
Wasn't
morning.
here
We're
when
back
I
to
did
it.
it, so I don't.
Right.
What it is.
They're doing a lot of very important work, so yeah, happy to do that.
But all of this is very important.
Very true.
That's,
So the $50,000 for the social workers is laudable. It's great. I think we just passed a bill, 259, that didn't depend on any funding whatsoever. Just bringing a group of folks together. So I'm going to suggest that we hold off on that one, even though I think it's critically important. We know from Groundworks in Brattleboro how important it is for social workers to be protected. If we can ask folks to bring us something legislatively without needing to have that funding. That's fine, but you can disagree with me. I'm just going through them. What Nolan looked like you're gonna say.
above that. And he was on the else.
Meals on Wheels. So I'm wondering if there's a way that if they, maybe not all of this money. 2 million seems like a lot to start out with.
I don't, is this response to federal cuts? I mean, there's a lot of Vermonters that depend on this.
Yeah,
I'll concur with Senator Cummings. I do Meals on Wheels every Friday, not during session, but
Yeah.
on out of session. And it isn't always just the food, it's the checkups.
it's the meeting.
It's
and
the-
talk.
They
I
are,
grab mail for them, I'll do the little bit of shoveling out front, I'll put down salt. So it cuts on the slips and slides and, yeah.
as my 99-year-old neighbor said when my son was the paper boy, she wasn't afraid being alone because the mailman checked on her in the morning and the paper boy checked on her in the afternoon. So she knew that two people were checking in on her. Meals on Wheels. We don't have
the other-
paper boys anymore.
Right,
Most of us don't have mail. So, Meals on Wheels is fulfilling a lot of that function.
okay, so some money for Meals on Wheels, the question is how much? Anything we can do to help appropriations. The question will be, we'll go back and look at the testimony that we had on that. I agree, it's important. So we'll just go check into that.
It's one of those, I mean, if they don't get fed at home, then they're gonna end up in the long-term care system.
Yeah.
Because they'll be malnourished. They'll fall. Something bad.
And chance,
Yes,
not for page number 20,
okay,
100 Brady, Vermont. 182,000, doesn't seem like enough. I know it was their request. It doesn't seem like enough to get rid of for that program.
So what line?
oh,
Number 20,
They haven't appropriated.
yeah, they haven't appropriated anything, that's what's concerning to me.
They've always been an advocacy group. And they were the prime advocates for universal school meals. There were hundreds of thousands of dollars spent on that campaign. And when I asked them where it came from, they told me they had generous donors.
That's good.
They didn't tell me where the generous donors were.
we are,
I think if you have questions, you can ask Amy
Yeah,
Goldberg.
Yeah.
Or.
Yeah.
that would be a good one, yeah.
okay, I just.
Yeah,
it's getting
ask it,
close, but-
And then bring back what you find out.
Sure.
And then we'll keep going, backwards on the Cathedral Square sash. The question might be all $2 million to expand to all regions of the state. What would happen if they had half of that? And we put the other half.
Yeah, so if you want a quick update on the Reach Ahead pilot program.
Oh, good. All right,
So it was a pilot program from June 1st of 23 to July to June 30th of 25. Part of the Reach Out family of programs, so Reach Ahead pilot helps people transition from reach out for post-secondary education to work. You're eligible if you live in Vermont, included if you have a minor child, that your benefit from reach out for post-secondary education has closed within the last 12 months. And there has to be at least one adult who meets the work requirement through paid employment. The Reach Ahead pilot may provide the following for up to 24 months: support to help you find a job, which may include car repairs or clothes or work supplies, the maximum childcare subsidy available, and a cash benefit to help you buy food. $100 a month for the first 6 months, and then $50 a month for the next 18 months.
Did we have a report on what they've accomplished? How many people has the pilot put to work?
Let me see if I
Are
can
they
find.
still
That
at
was the
work?
question I was asking.
I mean, what did we get for our first?
Yeah, let's listen to that. I mean, it could be that the year 26 is gonna be a kind of a critical year where we see a downturn in support from the federal government. And it could be that this is one of the things that helps people get out of homeless situation into jobs.
Are these homeless?
No, they're just on reach up. They could be living in an apartment or somewhere else, but it could give them a,
These are the
A
people
leg up.
that are probably most vulnerable to federal costs.
Yeah, that's what I was thinking.
so, we're gonna move up back to, the question I had about Cathedral Square and the SAGE program and moving it across the state. That is a question we need to ask.
Yeah.
What would happen with less?
Mhm.
And then,
I could leave that million to put toward the Reach Ahead pilot.
I'm sure one thing we did not mention, maybe you could fill in the blanks here, what's the timeline for this committee in making a recommendation to,
tomorrow.
I just want to have it said out loud.
We need to have this conversation and then we're going to put together our priorities tomorrow.
Okay.
Yes,
Would you like each of us to send an email with some bullet points of priorities, thoughts?
sure, you can bring that in tomorrow with you. And yeah, send it to us, send it to me and send it to Nolan tonight and then we'll put it all together. I think it has to be a committee discussion and decision. At 10 o'clock tomorrow, we're gonna try and put this all together. We might start earlier. Okay. Kiki? Oh, never mind, can't do it. All right, the council already has money in from the VHCB,
Thanks.
one-time funding.
Yeah, because you're right on, it's gonna be, we wanna put things in, what do we wanna take out?
Well, you know, in some ways we can be considerate of that, but in other ways, the appropriations can.
Yeah, I mean, somebody's gonna
Yeah,
do it.
it's gonna happen. That's why I think we set our priorities better. Okay. The Vermont Network, some of the Vermont Network, work will be included in the H91, but not all of not all requests that are here. Any comments there? At this point. And then going to, I'm gonna suggest we leave the childcare piece for now, simply because it's going to be, there's a lot of discussion going on regarding childcare special fund that we have and how that money will be used. And this is part of that discussion. I think think about this, one of the things we would like to, I'd like to ask you is, there is a special fund that comes from the payroll tax for childcare. And then there's been an interest on the part of the administration or governor to take some of that money and use it for other purposes. The discussion in appropriations has been to make sure that that money is held, because it's the first year we're seeing it. We may have more than we expected, and it would probably be best to hold the money until we know exactly what the needs are going forward. So the question is, do we recommend that that fund be held to and used for childcare purposes, or to use it as a bank for other things?
Well, when we did the bill, there was a commitment that we would put general fund money in. That's 19 billion, right? That is the state share. Payroll tax only be
We're max. We're max. Yeah, we're max. Sorry.
anyway, the question, that's if we put that 19 million in reserve, that's 19 million in general fund. I assume we don't have to fund some of these other things. So
This is exactly the discussion that we're having.
Yeah, the governor spent 19, the House spent 14.9, and put the other difference into rates.
in the rates.
Into rates for,
Early child, younger kids, the
Infant
little
toddlers,
kids, the
thank you.
toddlers, infant toddlers,
Infants is, yes, because when we
4.5.
did pre-K and put them eligible for school funding.
Yeah.
So any kid that goes, we reduce the number of pre-K kids, which requires less staffing. And most childcares were using the funding they got for the pre-K kids to supplement the funding they got for infants, because the staffing requirements for infants is higher.
Right, need more
And when we
staff.
went off that top, we left them with a deficit of 5. It's my understanding of the issues we were dealing with when we did childcare.
we always knew the timing of the child care payroll tax would come in higher.
Yeah.
There will come a point where, the revenues and the expenditures will meet or even crisscross.
Still doing it,
But that's, yeah, exactly.
but
Okay, so I'm gonna move, we did, Senator Gulick helped us out with the non-legal aid piece there, those two, 26 and 27. I'm gonna check those off. I'm looking at the CDOEO request for $550,000 for operational expenses to stay afloat. My suggestion is we leave that one alone for now. That is an interesting request. I'm imagining that there are other CAPs or OEOs that could use some support. There are other organizations that can use operational support. And we also have H91 that we're considering, which will affect that organization. So then we'll go to VCAP, VCAP, that's in 47. Oh, this relates to, well, it doesn't all relate to 91, something that does, I would just say. Let's hold those. We should hold those when we get through our discussion on H91. Now, 23 and 24.
Yeah, that should all be folded in there.
Yeah. Then, children's integrated services. I'd like to hold this thought. I think this one is something that we should, consider. Um, it's in the base. I'm wondering if it's base. 22.
22, okay.
These are the folks that sometimes get lost between the cracks, and there's a lot of volunteer work that goes on with this group. Let's just put a little hold on that. And then,
Is that that's a state program, right? Out of agency human services.
Yes.
Okay. Because
well,
some of these are run by the state. And the social workers are state employees. Others are run by private agencies. This one is run by a private
Yeah, it's a
agency.
handful of individual agencies, but it's managed by the DCF.
It's managed.
For the
by
record.
these-
Oh, I'm very sorry. For the record, Nicole Sedu, I'm the director of policy for the Department of Mental Health and the Human Services.
So we have a separate group that is providing a service under contract and supervision by the state.
and so what is your conclusion then about this?
Well, no, I'm. To me, it's a basic state service under. I'm assuming that this is a privatization. Yeah, right. Are these people covered under state
Yeah.
labor contracts?
I'm not familiar with it, but I know like the Howard Center runs a program, NCSF, they are very similar to
Okay.
that. So they have a per member per month, a few $100s.
Okay,
And I'm guessing.
all right, so it would be like the Howard said.
Is a fiscal agent for one of the CIs. Yep.
So then the
They're
question,
a mental health, a designated agency, like mental.
No,
health.
they're largely not. I'm just familiar with the Howard Center because I know they're the fiscal agent for one because I work with them,
Okay.
but they're largely other organizations.
okay, so Matt Levin, you want to say something?
I'd be happy to answer Senator Cummings' questions afterwards. That's
Okay.
Probably the most appropriate time.
We're good. We're
Thank you,
gonna
Madam
hold it
Chair.
open for now.
Madam.
Then the request for the Parent-Child Center is $500,000 from the Tobacco Settlement Fund for a grant to provide prevention services to pregnant during pregnancy for smoking cessation. So that's that on 21. I don't know how you feel about that one, so I'm gonna hold that one open. And then we've already had a conversation regarding food and food bank, and so you go back into your thoughts on that. Send your bullets in on that one. And then going to, now we get to some of the primary care and medical services. So this is the Gifford proposal that Michael Costa brought in and Melissa Belansky regarding. I think Melissa Belansky.
Yeah,
Did she make one that?
Isn't this the one where they're
In Wyoming.
creating positions in rural Vermont because they would stay?
So there's
But
two of
it's a
them.
new program.
There are two of them now, but it seems like it's one together. So I'm going to turn to Mary Kate Molman to clarify.
I'm happy to clarify, Madam Chair, Mary Kate Holman, by State Primary Care Association. Lines 10 and 12 are duplicates. Those are the same program. And then lines 13 through 15,
Wait, which two lines are duplicates?
10 and 12.
Okay, okay.
Lines 13 through 15 are future year requests. They are not for fiscal year 26.
Right, I saw that.
Okay.
They're for future out. So the 10 and 12 are the same. So if you approve one, you approve both.
And just Melissa Belansky has been Memorial Health Partners, but now she's leading up the Maple Mountain Consortium organization.
Okay, that helps significantly. And then
That's just
there's
this Maple Mountain.
Maple Mountains.
Maple Mountain Health Center
and
is
Gifford
going up.
are same. And then the lines 13, 14, and 15 are all at out years.
Mhm.
Okay. The blueprint for mental health pilot project, continuation at existing Dulce sites, I think is something that we should value greatly. That's me. I like suggest you give me that. And then
We gotten toward of what the Dolce.
we had the blueprint report and
What is the Dolce?
we could all
Doing
say
that for a number of years, what is it?
it's being done. We did get a report on it, but we can go back and look at it again if you like. We could maybe have phone a friend on that one. I don't know. Who I-
We'll find me.
Yeah, that would be helpful. So skip over the special funds. Because they're in 218 that we're gonna look at. And then we have the recovery partners looking for money in the base. Ongoing operation. So gas. I'm gonna suggest that was part of my conversation earlier. That one, they may have to wait for me. Okay, and then we've been through lines 1, 2, 3, and 4. Line 1 is covering the year 26. And then the question around Medicaid rates for our DAs or SSAs and others, home community-based services is how much? Well, yeah, we are. Okay. I know they need it. We gotta get them up. How fast and how much. But it's all matching funds. Well, yeah, so that's good. If we can get the federal dollars this year, then I think we should go for the federal dollars this year because we don't know what's going to happen. We don't know what's going to happen in the,
Talking rate increases.
yeah, I am, but we just don't know
And
what
what happens if they rescind?
Right, then we rescind.
Yeah.
We can't do it without, we can't, we'd end up with the state general fund match being what potentially would be used. I don't know how we do that.
Depends on how they document it.
Yeah,
That's the danger. You start something and then you pull it back.
kills people.
The bigger issue is gonna probably be, way that they reduce our ways that we have to either come up with more general fund to pay for things.
Right.
And then the other things might be what is compete, if they go after a waiver, then we're losing our investments and everything else. So, but straight Medicaid rates. There'll be Medicaid matches, no matter of what that trades and how much general fund is available after they do X, Y, and Z cut. It becomes part of the mixing bowl of horribles, right?
I mean, the House has actually reduced the amount, in both line 1 and line 2.
They didn't reduce it, they just chose to fund. It was, remember reductions if they had it and you took it
Right.
away.
Well,
House decided to give them more than what they had, but not quite what they asked for. So remember, one's a
It's
one-time.
below the request. All right,
I mean, are we agreeing that there's a general policy that we don't want to fund new programs if we don't know that they're gonna be able to be sustained? Because, I mean, I hear that, and I also think it might be an opportunity to keep people safe for at least one more year, regardless of what is coming in the future.
but if you're gonna give money to start up a new program, it's a start-up, if it's start-up funds, not necessarily gonna be the program, and then you're gonna stop it. It's a conundrum.
We did somebody
Paradox.
property house for 2 months and then back out.
So think about this, think about what we might be able to do with the opioid settlement dollars that have not been recommended for some of these things. And that could be recommended with appropriate language. And we have a bill next year that would rely on opioid settlement funds that could do the startup that we would like. We should do a startup this year. We don't want to keep operating something with opioid funds. It's just like.
So recall, and that's probably our next conversation. I don't know when you segue to
We're
that.
gonna segue right now.
Okay, and that, you know, I'll say it again when we doing 218, but the opioid abatements fund was front loaded. In different, not front loaded, but different people that had to pay paid in different ways. Some of them paid up front, some paid ahead, but the funding will decrease over time. So the amount of money that we are funding in this year, 218, it's all one time. And there, you know, there's some intent language about what should be funded going forward. But those revenues in that fiscal, you'll see the revenues will diminish over time. So the amount that we're funding today, we might not be able to fund that same level in 3 years, 4 years, 5 years. The one thing that is not in my fiscal note, which I might as well pull up, is the Sackler for due settlement. We don't know how much that's gonna do. So
So the question might be, what is your plan to become self-sufficient of the time?
Yes,
When we start you up,
yes.
what,
Good question.
what's your, yeah. What's your plan?
Okay, so please go through this, think about how to establish your priorities and our priorities generally as a committee, and then send your bullets to me and copy Nolan and Kiki, please. And then what we'll do is we'll try to consolidate and put together our recommendations that will come carry along the whole way. It's really sad, I think, because the needs are so great in our state. People need so much help. And there's cruelty happening out there at the federal level, and I don't want to be part of that.
West Virginia is involved.
Huh?
West Virginia is involved. And there's cruelty everywhere. It'll take a while.
I know. It's traveling across the country.
would you like me to go through my H218?
Yes.
No.
So now we're going to 218, and you have a fiscal note in front of you. You also have the bill, but let's take, no, why don't we go through the fiscal note?
The fiscal note and the bill are pretty similar.
Right.
The bill, and I won't go through every line. And I think that if you have questions, we do have the fortunate of having the chair of human services here who can answer questions if you have them. But what this fiscal note is literally what's in the bill. And the bill is basically an opioid abatement fund appropriation code. And with the other language around duration intent, you know. So, and I will, and I know that to channel the Human Services Committee, they did their best to stick to the recommendations of the opioid abatement committee, correct? And so I don't think they've really deviated from that.
Did you present this bill to us previously?
That's why I'm here, Madam
Oh, why
Chair.
don't we let,
Yeah, that's what I thought. So why don't we let the chair of House Human Services presented
all
the
good.
bill, and then.
Oh, good. Nolan was doing a good job.
Wait, you did a good job.
Good morning.
Good morning.
It is still morning, I guess. Teresa Wood, Chair of House Human Services. Yes, as Nolan said, House Human Services really took great pains actually to avoid deviating from the recommendations of the opioid advisory settlement committee. One of the reasons that you might recall, if you were here last year, there was some disagreements or some perceived disagreements between recommendations made by the Commissioner of Health versus what the Opioid Abatement Settlement Review Committee recommended. And so there was in statute last year change made to the process to enable both the Commissioner and the Settlement Advisory Committee to both submit their own recommendations. Happy to report this year that the Health Department really worked on the process and it being more inclusive and transparent. And they both came with the same recommendations. And so the Health Department, as well as the Advisory Committee, came with the same recommendations, which I think is an important step in understanding how this settlement funds work.
And can you have them stand up and let Katie sit here? Thank you.
He has the credit, he offered what you
He
first
did,
of all.
yeah.
And
Okay.
she said no.
Oh, no, no, I say yes. Thank you for
Mr.
doing that.
So the I just had one other thing I wanted to say there. What was that?
The process,
Yes, the process ended in a good collaboration between the advisory committee as well as the Commissioner of Health and his recommendations. Oh, I know what it was. So this is the third year that you see funding from the settlement. And it has been in bits and pieces scattered throughout the appropriations bill, which has been confusing for people. So the administration asked this year if we would be open to having it run in a separate bill because it's a special appropriation, has a separate set aside fund. And we said, sure, we thought that that would actually add clarity and make it easier for not only us to follow, but the department to follow, as well as the potential recipients of these grants. And as Nolan started to say, there are 4 programs that we in legislative intent language said that they would have ongoing funding for the duration of the however long the fund lasts. And Nolan has some good information about sort of the projections about the use of the fund. And as he said, it is, we don't know what future lawsuits might bring, but we have identified sort of 4 key things that are ongoing in nature. And then some of the other things are, exactly what we'd like to see. Some of the smaller grants are to places all over the state. They made, a good effort to not just be sort of located in the northern part of the state. And the other aspects of the bill that we changed were that requires the advisory committee to look at the outcomes before making decisions about future funding. And so that's a piece that we added. We also, because the commissioner is the chair of the committee, and they had no real spokesman for the committee. That's a non-administration spokesperson. So we opted to add I don't remember if it was co-chair or vice chair, but I think it was a co-chair of the committee. And Katie will walk the language through with you. But we had sort of a de facto spokesperson, just because that person had, testified in our committee several times before. So we contacted her, she contacted her colleagues. Is it okay if I speak? And so it was just a little awkward. So we felt like, there's no reason not to have a co-chair or a vice chair that can speak for the committee as a whole. since, the commissioner is a non-voting member, I believe. That's where we're at on that.
Oh, I see the language there from non-governmental members.
Yeah,
Yeah, okay. Sounds great. Thank you for that.
you're welcome. And, you know, there are a lot of needs out there in this area. And, I will say that there was lots of discussions back and forth with our appropriations committee about, well, could we add this? Could we take away that? And in the end, we opted to respect the process that actually worked this year between the department, the administration, and the advisory committee, since they both came with the same recommendation. So that's what we ended with.
Good. Questions for Rep. Wood?
And Representative Dwyer reported the bill, but he's otherwise detained, otherwise he would be here.
Thank you. That's good.
He's in a good week this week. He's back this week.
Okay,
Alrighty, thank you.
well, good. So there is a language in here about process and governance.
Your notes, I think. Get that right.
Okay.
Thank you.
You go back to work. Do you want to do the language first? So why don't we go through the appropriations pieces first and the fiscal note, and then we'll go to Katie with the language. Does that work for you?
That works for me.
That can be quick. And I might even save Katie some time to travel briefly
Yes,
as well.
please. Yes, okay, good.
It's all in the note as well.
I have a question while we're in this moment.
Yeah,
It's the money for needle exchange, is that?
no, it's separate. It's part of the Ryan White program, and it doesn't come from this. It's an ongoing base funding. And then they ask for more. And then the question is, it's an exchange, but we never see the needles exchanged.
Yeah.
So someday we're gonna have to talk about how to have those needles picked up and brought back when they exchange for new needles.
Where do they?
On the ground.
So they find them most of the time.
Yeah,
They are, Yeah.
Discarded onto the ground.
city of Burlington is having a real issue with that, and I'd like to shore up. So yeah, speaking for mine and our
Yeah.
You wear
constituents,
gloves when you pick
the
them up.
downtown sector, Burlington.
go ahead, Senator Grulich. Let Senator Grulich finish.
Thank you, or start even. Yes, I recently heard from the Church Street Marketplace folks, as well as people living in the downtown Burlington area, and the issues that came to a fore very passionately and vocally were, the needle exchange and what's happening with that in terms of, the environment around town. Obviously homelessness, which I know we are addressing in here, as well as mental health, which I know is here as well. And, the opioid crisis kind of in writ large in general, as these are things that are really affecting, our largest economic engine in the state. Or one of our largest anyway, and, people are feeling very vulnerable right now.
So I might want to work with you on putting some language together that we can share here.
So I can just orient you really quick to this fiscal.
Please.
I'm not gonna walk through it,
No.
but what I want to show you is what I have here. Bill proposes to appropriate $9.9 million from the opioid abatement fund for the uses in fiscal year 26. I have everything listed out, tied to the section in the bill. So what the program description is, what agency or department which appropriation will be going to. The amount, and then also there's some of the initiatives have duration intent, even though it's one time. It might, for instance, the outreach workers, the intent is that it be funded annually as long as there's money left in the fund. Or for number 5, the grant to Burlington, the intent is for them to be funded through annually through 2028. So again, this intent language, because it's one time, but they put it in the bill to give you a sense of future legislatures, what was the intent when you did this time. The last thing I want to quickly orient you to is I was touching upon it. Actually, two things. One, I do have a list of how the money has been spent in the past through the different acts, so Act 22 of 2023, Act 178 of 2024, and Act 113 of 2025, just so you can see how money from this fund has been appropriated in the past. There's been $14 million appropriated to date. And as of the end of the year, there was $12 million of unappropriated. So that was your starting place for this. So that's the one is the contract for how much money is in the fund for them for you to appropriate forward. And then the last piece is this chart shows that. And so when you take that 12 million and you subtract that to 9.8, you have still 2.16 left unappropriated as past the House. But then going forward, you're not going to have as much money. You can see in 2025 and 2026, it goes up to 4.15, 4.45. It sort of hovers around between the 4 and 5 million until 2032, and then it starts to decrease. So the money you will have in the future is how much money is in the bottom of the line that you haven't appropriated, how much money is coming in. So you can see the current year, you're spending $9.8 million, $9.9 million. Next year, there will not be that much money, especially if the more you spend this year, the less that's left over for future years. So that's what I just kind of wanted to flag. Again, the one thing that is missing from this is the Sackler Purdue settlement. That was the one around the opioid. I forget what that was, but I think people are familiar with that. And there's currently in bankruptcy court, and the amount of money states would be receiving, and how much is it over time? Is it lump sum? How has yet to be determined, and or has it been publicly released? And I spoke to the Attorney General's office. She said, well, information is starting to roll in, but it's still uncertain. And they didn't have any information to share with me about how much that would be and how it would be paid out. So there would be some more money, but it might not be a lot, or it could be a lot. I have no idea. But I just want to flag, the more money you spend this year, the less money you have going in the future as the amount of money comes in. That's all I want to say.
The settlement is going through bankruptcy.
The Sackler Purdue settlement.
Sacklers,
Okay, so not the settlement.
they've declared
Good.
bankruptcy, and
Okay.
then the question is, what does that do?
Was that settlement look
Okay,
like?
that made, okay. thank
Yeah.
you.
And how much money do states get
Because if
out of that settlement?
if you restructure your finances, you're not liable for certain.
Right, no, I understand. It was the writing confused me, but I get it now.
Yes, thank you. I mean, I know as we go through this, I think you'll notice there are some things related to this year's budget regardless. So some homeless relationships, some of the caps, counseling and positions for counselors. And so these are all one-time funds, and now there are positions put in here. And that means the question will be, how many years can those positions be supported by this fund before?
The other conversation that was had in human services was that from the previous years, not all the money had been spent. So for instance, the 1.1 million for Burlington, we
Right.
appropriated the money, they haven't spent a dime of it yet.
Right.
So as the bill came out of human services, they didn't give them the 1.1 million again. But House Appropriations had heard from Burlington after that, saying, well, we still want the money because we plan to spend both of it. So it was a matter of time. Like they haven't spent the first 1.1, they now need 2.2, right? Because they still have the 1.1. So, and then some of the other stuff, like from the previous bills, hadn't actually gone out the door. So I do have that chart, can show it to you or not show it to you. It's a little dated, but it would give you a sense of all the different appropriations, what has been spent and what hasn't been spent. And that went into a bigger conversation the Human Services Committee had. In the end, they still went with recommendations, but were mindful of and had brought in human services folks, HSIS folks to sort of say, well, why hasn't that money been spent? What's going on? Sometimes it's contracting. There's
A
all
lot of
different-
work going
It's
on.
a lot of work.
It's
It's a lot to do, and each of those has a different reason for why. Some of them were that they didn't have anybody apply for the money, right? So there was how much was of how much was allocated, how much was allocated and unspent, and how much was unallocated. So I'm happy to share that with you, or we can go through it another time, but that was part of the conversation that the other committee was mindful of when they made these recommendations, when they did this.
Well, so let's look at the language and then if
Yeah.
folks want to come back to that discussion, we can do that. I'm satisfied that they need to continue to receive the ones. They're getting
Yes,
close and they're doing an awful lot.
yeah, me too.
Katie, why don't you help us?
Do you guys want an update on reach ahead mode and transition? Number of families enrolled in Reach Ahead has increased from 231 in 2022 to 262 in 2023, then to 348 in 2024. With the Reach, this was with the pilot program, the Reach Ahead pilot program. More families are leaving Reach Up and going to work than in previous years because of this Reach Ahead program.
Cool.
Yeah.
How many?
I am working on that. I hope
Yes. Is it 2 or is it 200?
One.
It's
that'd be fine.
Well, let's hold that thought.
Yeah.
Yeah,
I'm just giving you a,
that's good.
That's-
Yeah, thank you. Good work.
thanks.
Welcome.
Thank you. Good morning. Katie McLennan, the Legislative Council. So this is H 218 is passed by the House. The first section is all of the appropriations for fiscal year 26, and then there are some policy changes and some language updates. Do you want to skip to that?
Let's go to that, because
Okay.
we've got the fiscal note, with all of the list, and we can go back as needed.
I'll just point out, that in some of the appropriations, they're divided into subdivisions A and B, and in those instances are appropriations and past years. There's been legislative intent of the intent to continue, that appropriation and subsequent years.
From the fund, or,
Yes,
not from general fund, but from the fund.
from the special fund.
Got it, okay.
So there's intent language in 4 places in this list, and then we have subsection B, that all grant agreements associated with funds appropriated pursuant to this section shall require outcome and measurements data to be collected and reported to the department issuing the grant and to the opioid settlement advisory committee. So both the department and the advisory committee are getting those outcome measures. So you'll see that in subsection B.
That's good.
And then we have section 2. So one change that you'll see repeated over and over again is the terminology around medication, MAT, medication assisted treatment, has been updated to MOUD, medication for opioid use disorder. That change has been made in many places in statute, but as we were, as Human Services was contemplating making changes in this chapter, there were some places identified where that still used MAT. So they took the opportunity to update those changes. So that's what you're seeing on line 7 and 8. Again on 11 and 12. And now we're in the section on opioid settlement advisory committee. There's language about membership. In lines 4 and 5, a primary care prescriber with experience providing MAT is changed to MOUD. Again, on line 8. With regard to powers and duties, same change on line 13 and 14. Same change on lines 9 and 10. And then in subsection E, this is language around the presentation that the advisory committee is required to provide to the policy committees. So currently we have annually the advisory committee shall vote on its recommendations. Recommendations shall be informed by outcomes and measurements reported by previous grantees. So that is sort of referencing the language that we've looked at on section 1, subsection B. And then towards the end of this section, top of page 9, the advisory committee's written recommendation shall address how each recommendation meets one or more of the criteria listed in subsections 474 B and C under this subchapter. So if you remember, or if you look at, the underlying, language when the advisory committee was first created and the special fund was first created, there is language that prescribes how the monies in the special fund can be utilized. If you remember, there was a settlement agreement. The AG's office worked with the committees and it was fairly broad, but also prescriptive in the uses. So the decision was made that the uses for the money would be put in statute. So what this language is saying is that when the advisory committee is bringing written recommendations to the general assembly, they have to sort of cross-reference which of the uses is authorizing the use of the proposed appropriation. Does that make sense? Yeah. Okay. In subsection F, this is the language that Representative Wood was referring to. Annually, the advisory committee shall elect a voting vice chair from among its non-governmental members. They chose to say voting vice chair because the chair is a non-voting member. So they want to be clear that the vice chair was a voting member. And I believe the only other changes are the change from MAT to MOUD. So see that on page 10, lines 4, 5, 7, 12, and 13. Bottom of page 10, top of page 11, and then again on page 11, line 8, and then 13 and 14. And then we have that the act is taking effect July 1, 2025.
Good. Questions for Katie? Go ahead. Superintendent Evans.
The advisory committee, so the voting vice chair section, those non-governmental corporate, appointees already have voting rights.
Mhm.
So everyone on there has voting rights up to the chair.
Yes.
Any other questions? Questions on the appropriations? Unless I hear differently, I don't think we want to make changes to the recommendations from the advisory committee. I think that you have a need for additional testimony on the bill at this time. Okay. That's good. It's pretty straightforward. Thank you. All right, that's good. So now, I think what we'll do is tomorrow morning, we have an open time at 9 or 9:15. I entertain a motion on this bill.
Page 218.
Yep, and so we can pass it down. We can do that later today if you would like, or we can get back together briefly, or we can do that tomorrow morning. I'm open to that. I don't know how the committee feels. We usually wait one day or wait a period of time before we vote on bills. This one seems a little more big than others.
I'm happy to move it on and out if folks are up with that.
Give it tomorrow.
I'd like to wait for a little longer.
Okay.
On line 5, hearing there has some money for the overdose prevention center. If that's what Nolan said, they already have 1.1. And they're asking for more. And they haven't used the money they already have. I'd like to look a little bit.
Okay, so we need to talk about that.
I'll let you learn.
I do, we can do that. I don't know. We have 10 minutes. David, do you have a capacity to share with us the work that's gone on at this point in Burlington on the OPC, and then what is coming? But that is a very legitimate question, I think, that people are going to have about the bill.
Sure. David Mickenberg here on behalf of the city of Burlington. So just last night, actually, the city council had a working session on this, lots of supportive comments in the city council. So just in terms of the timeline, last year, the bill, I think that 170 or whatever, the stage 72 last year passed, and there was guidelines that were that the Department of Health set up in September 15th of last year. The city moved so that nothing could move forward without those guidelines in place. The city moved forward quickly to hire somebody to help implement the legislation. They did hire somebody, and since that time, they've been working to move the project forward. What they've done in the interim is they found a provider. So they put out a RFP process. They found the provider. They've now partnered with the provider. And prior to the money really flowing to the city council has to vote on it as part of Act 178. But they plan on using that money in FY25, at least as much as they can, and then beyond, and have put together an entire budget into how this money will be used for the startup, building out a facility, staffing up. And so there's no doubt that the 1.1 that was allocated last year is needed and will be used at least in part in FY25, and then will be incorporated into the FY26 monies. So, and as was mentioned, other folks that are on that list also have not used their full allocation. So it's not unique to this particular project. So.
Yeah, a lot of the things that are, I mean, when you look at hiring people or you look at putting a program in place, it takes a lot of time.
Yeah, and in the presentation yesterday, they were talking about a lot about the organization that's been selected about being sort of a good neighbor and doing things like the outside of where the OPC is, making sure that there aren't needles that are discarded outside. It's not just the walls of the program inside, but it's the outside as well. So they're putting all of those pieces into place so that the program is effective at what it sets out to do.
Questions?
One of the things we've heard the last 2 years in this committee is how critically important the location of an OPC is. It'll fail or it'll succeed very directly related to where it's located. So I think Burlington is being very deliberate and being careful and really doing our due diligence to try to find a good location for that OPC so that it works. You can't just plop it somewhere and hope that it works. It's really important that we have the right location. So I think that's part of the time thing that's happening.
Absolutely. And that was a lot of the discussion yesterday at the city council meeting. It was really spending the time to make sure that the community engagement is happening, to make sure that the location is appropriate, public safety, the interacting with law enforcement and first responders. Just by way of example, the state of Rhode Island has an operating overdose prevention center, and Brown University just did a survey about the neighborhood, and they found that 74% of the folks in the neighborhood supported being there, which was great. So I think they took the time to do that. I think Burlington is being diligent and deliberative in making sure that this works for the community. And so that's I think they frankly have been working as fast as they possibly could. Some of the programs that are funding are existing programs. This is standing up a brand new program. So I think they're working as quickly as they can and doing it responsibly.
Other questions for David? Okay, thank you for it. So, all right, so we'll go first thing tomorrow morning on H218. We'll put up the vote, and if you need additional information somewhere, I have a list of all the things that Burlington has done in preparation for the OPC and the work that the Department of Health has done for that. So if you could get that to share and you put it on our webpage, I think that would be good. Okay, good. Anything else for Katie? No.